Good evening and welcome to Talk with Your Doctor. I'm Doug Eberhardt.
And I'm Dr. Jeffrey Jarry, Senior Vice President for Medical and Academic Affairs at the St. Luke's University Health Network.
Tonight we are pleased to be coming to you from the Vinci Science Center in Allentown, right in the center of their exciting exhibit, Bodies Revealed.
What a perfect setting to discuss medical education at St. Luke's University Health Network and the special partnership between the Vinci Science Center and St. Luke's to promote a greater understanding of the human body and its systems.
The world-renowned Bodies Revealed exhibition is part of a year-long community education initiative, the Year of the Human Body Project. And here to tell us more about it is Troy Thrash, Executive Director and CEO of the Vinci Science Center. Welcome, Troy.
Well, welcome to you. Welcome to the Science Center.
Thank you.
Thank you, Troy. Troy, the Vinci Science Center and St. Luke's Health Network have decided to partner to present this exciting exhibit, The Bodies Revealed. Why don't you tell us something about the exhibit and why it's such a good fit to have that kind of partnership?
Sure. Well, the Bodies Revealed exhibit coming here was about 18 months in the making. This is the Science Center's first real blockbuster exhibit, and we're so excited to be able to have it here. This is an exhibit that plays in large cities around the world, and to be able to bring it to the Lehigh Valley in conjunction with St. Luke's has just been fabulous. So the exhibit itself really falls into what we really focus on here, which is bringing the textbook to life for kids, for adults, for teachers, really for the community. And it's quite amazing thinking about anatomy books, you know, what you see in there, what you read in there, and then suddenly you're standing face to face with a real human body, giving that understanding of exactly that incredible machine that ticks inside of you every day. It's quite amazing.
Yes, it is.
Seeing is believing.
Absolutely.
The exhibit's been here for a little more than a month. What has been the feedback so far? What are the people who've been here saying about it?
The feedback has been absolutely incredible. I can certainly tell you just by the numbers that we've had over 3 times as many people here visiting this exhibit and visiting the Science Center as we did the same period last year. So we're very excited. We were hoping we would find a market for this here, and there's no doubt that that's happening. But really, what we're seeing in the faces of not just the adults who come here, but also the kids as well. The experience that they're having is really just truly remarkable for us. We're hearing so many positives. And teachers as well have been very excited about being able to bring their students to see this exhibit.
That's wonderful.
Yes.
Troy, as you know, our show tonight is going to be on medical education. And we know that our residents and medical students have been a part of this exhibit. Maybe you can tell us a little bit about how that has helped in the interaction with the public.
Well, sure. Well, here at the Vinci Science Center, we have exhibits that really run the gamut of science. And we've got about 160 volunteers, many of whom work the floor, and they're very knowledgeable in what they do. But with an exhibit like this, we realized that we really wanted to provide the public that in-depth experience, and we wanted to make sure that all of their questions get answered, whether they're looking at a full body or maybe the difference between a healthy lung and a diseased lung. So the opportunity to have medical students, medical professionals from St. Luke's University Health Network here to really give that experience, to really, for our public, to ask those questions and get those answers on demand, to really provide that understanding real time, has really been great. And again, we've heard so many positives about that we're able to make this happen with St. Luke's.
Oh, that's super. And I'm sure it's also been equally important for our students and as well as our residents to interact with the public in that way.
And we hope so. One of the things that we do here, whether it's working with teachers and perhaps medical students as well, is provide that opportunity to be able to communicate what they know and what they're learning real time. So far it's been a wonderful partnership.
Glad to hear it.
Valuable to all those involved. Seeing promotes understanding, and there's a lot to understand and a lot to see here with all the full body human specimens. If somebody wants to come out and see it, how how are they able to get tickets?
Well, they're certainly able to just come and walk through the door. This exhibit is going to be here from now until at least February 10th, and if all goes well, we may be able to extend it a little bit later. But you can certainly check our website. You can buy tickets in advance, and there are going to be some busy days, like through the holidays, and weekends can be busy, but you know, you can just walk right up and enjoy.
So tickets are certainly available.
Tickets are always available.
And I understand there's also some exciting things to follow.
There are. Well, this is really the cornerstone of what we're calling our Year of the Human Body. The focus of the Year of the Human Body is to provide exhibits, programs, experiences that ultimately what we hope to do is build the next generation healthcare industry, their workforce here in the Lehigh Valley. And so with Bodies Revealed, after that, over the summer, we're going to be hosting an exhibit called Grossology, which is all about exactly what you think, the gross parts of the human anatomy. In between, we'll be doing medical, mini medical schools and all sorts of other programs as well. So we've got a full year ahead.
That's really
Good luck with it. Thanks for joining us, Troy.
Thank you so much.
The Bodies Revealed exhibit is here until February. Come out and check it out. And of course, seeing all these human body specimens, it could inspire the young people who attend this exhibit to become future doctors and nurses. Speaking of that, we'll delve more into medical education with some of St. Luke's staff, and we'll do that right after this.
The human body, everybody's fascination. This is Bodies Revealed, the most talked about exhibit of our time. Real human specimens in 9 different galleries, each hosting its own body system, from skeleton to complete body and everything in between. Explore deep within. Bodies Revealed, totally mind-blowing and not to be missed.
Now open at the Da Vinci Science Center. Tickets available at the box office or bodiesrevealed.com.
Welcome back to Talk with Your Doctor. School is in session tonight, so to speak, as we continue our discussion on medical education from the Da Vinci Science Center here in Allentown. Time now to meet some panelists who are directly involved in medical education at St. Luke's. Dr. Jerry, please.
Thank you, Doug. We do have our 3 guests with us tonight, and our first guest is Dr. Joel Rosenfeld, who is the Chief Academic Officer at St. Luke's University Health Network and is also the Senior Associate Dean and Professor of Surgery at Temple University School of Medicine. Welcome, Joel. Next to Joel is Natalia Levitska. Natalia is a second-year student at the Regional Medical School at Temple St. Luke's. Welcome, Natalia. And lastly is Dr. Nicholas Tatalius. Dr. Tatalius is a first-year resident in family practice.
Thank you very much.
All right, welcome to all of you. So let's start off with a question for you, Joel. St. Luke's has had a long history of involvement in medical education. So why don't you tell us something about the full spectrum of that involvement and why it's important for a hospital network like St. Luke's to be involved in medical education?
Jeff, it's a very good question. St. Luke's is totally involved in medical education. We teach medical students, physicians in terms of residents, interns, and we teach continuing education to our staff physicians. We also have the oldest continuous nursing school in the United States. And we also have a program with Moravian for a Bachelor of Science in Nursing, as well as various master's programs in nursing. And we also train many different technologists. We train pastoral care students. We also train administrative medicine students. So we're totally involved in that. Now, why is it important? To make sure that we have enough physicians and other healthcare workers to take care of the patients in the communities we serve. And also, it keeps us sharp, the doctors, the nurses, the different technologists, because it's a total learning involvement at St. Luke's.
So it really is a win-win situation. It's good for our community and good for our students as well as good for the hospital itself.
Absolutely.
Keeping them sharp. Dr. Rosenfeld, can you tell me about the phases of medical education? How does one go about becoming a physician via St. Luke's? What's the process?
St. Luke's is involved in all 3 phases. The first phase is the undergraduate phase involving medical students. The second phase is that of intern, resident, fellow. Intern is usually the old name given to a first year of training after medical school. Then you have residencies, whether it be in surgery, internal medicine, OB, GYN, pediatrics, etc. And then the third phase is that of fellowship training, and that's more advanced residency training in terms of subspecialties such as cardiology, sports medicine, critical care.
So the average number of years that a physician would spend in total training from college on would be?
Well, you have 4 years of college, taking the sciences, pre-med as they usually call it. Then you have 4 years of medical school, and then anywhere from 3 to 5 years of residency training, and then possibly another 1 to 3 years of fellowship training. So it's a long, arduous process.
All right. Now, Natalia, you're along in that process right now as a second-year medical student, and you've chosen a regional campus as opposed to going to the primary urban center in Philadelphia. So maybe you can tell us a little bit about what went into that decision in selecting our medical school.
Yes, definitely. I think that one of the main reasons why I chose the St. Luke's campus is the smaller class size that we have here, because I felt that I would get a greater education by being in a small group setting where I would not be afraid to ask questions in class as opposed to being in a large lecture room. And I also saw an opportunity to build closer relationships with all of the professors here and the physicians who we get to shadow. And another thing is getting to know all of the students in the group. When there's only 30 of us, we can become very close, like a family almost, and I feel like it's a great support system for us.
That's great.
Good idea to have a sort of a family atmosphere when, as Dr. Rosenfeld said, it is such a long haul en route to becoming a doctor.
Yes.
Can you tell us about your future plans and how it's going thus far for you?
Well, so far it's going great. I'm only in the second year of medical school, so I have a long way to go. I'm considering gynecology and obstetrics for my future career, but I feel like I need to keep my options open, just in case I like something better.
And you haven't gone through all the different disciplines yet?
No, not yet.
Okay. Nicholas, you've chosen as your career family practice, and that is a primary care specialty that is in very high. What went into your decision to choose family practice as your career?
It's a really important question. One thing that really sticks out in my mind from the first 2 years of medical school is how when you're studying the pathophysiology of disease, how by the time you get to a really advanced stage disease, so patients that have heart failure, heart disease, COPD, diabetes, there's so much damage that has been done already that we're basically working on borrowed time, even with the advanced medicine that we do have. So really the best way to prevent disease is to prevent disease. So that's why I feel that primary care and prevention is a really important part of medicine, and unfortunately it's overlooked because either people don't have access to it, people are unaware of what is out there, but it's very effective, and you know, I think a lot of problems in our society would be fixed if we had a little bit more access to some primary care.
Absolutely.
And preventative measures. And Nicholas, why the primary hospital versus a urban center for you as far as a med school?
Yeah, so I've been very lucky to get to see all the different parts of St. Luke's. I was actually here as an undergraduate. I was here in medical school in 3rd and 4th year, and I really got to see how this is a special place to learn. There's really a big emphasis on up-to-date medical information here that's very effective and efficient. And I think that it's an environment that's very supportive, where people really care about each other, care about giving comprehensive care to their patients. And it's a really great place to learn. I've really had a great experience so far.
And you were a Temple medical student.
I was, yeah. I got to, you know, see all the different parts of the hospital, and we're lucky. This general area has a lot of great medical centers, but I feel this area is a really special place.
All about the experience and the results, and of course the benefits for the patients on down the road. We'll take a break. We'll continue to talk with our guests from St. Luke's and about the education process. We'll do that in just a minute. Welcome back to Talk with Your Doctor from the Da Vinci Science Center in Allentown and our discussion on medical education. And Dr. Rosenfeld, earlier this year, St. Luke's changed its name slightly to St. Luke's University Health Network. and I understand that's because of the continuing emphasis on education there. Can you talk about the name change and its significance?
Absolutely, Doug. It was a true honor to be recognized by the Commonwealth of Pennsylvania as a university health network. We, on any given day, we have 100+ learners. And I say learners because this is medical students, residents, fellows, nursing students, and continuing technology students in various disciplines, and our continuing education for our attending faculty staff. So it was, I thought, a great way to recognize all the education that is performed at St. Luke's. As I said, over 100 learners a day, and in a year, we probably educate close to 1,500 different students.
Great. Natalia, I'm sure you've had some preconceived notions of what medical school would be like. Has anything been surprising to you? Your medical experience met your expectations?
I think that for the most part, my expectations have been met. I knew that I would study a lot. I knew that it would be very hard, but I never thought that I could learn that immense amount of material in such short amount of time and actually know something. I always felt like I would be struggling and lagging behind all the time, but it's not happening to me. So I think that we all become very efficient in learning as we enter medical school and just become better and better with each continuous block.
That's great. And Nicholas, maybe to add a segue to that, since you're further along, has there been anything surprising in your postgraduate medical education so far in terms of your residency, or is it really what you've totally expected?
It's been a great experience, and you know, I think touching on what I was mentioning before with being a very supportive environment, I feel like this is a place where you can really learn. You get to learn how to practice medicine that's effective, and you're also supported along the way. So, for example, when you're on call, as an intern, you're never by yourself. You always have an upper year resident. You have attendings that are, you know, a beckoning call away if needed. So you have a lot of support for yourself there. And that's a really, you know, important part of the program.
So it's great to hear that neither of you have been disappointed so far.
Oh, it's been great.
Good.
Dr. Rosenfeld, St. Luke's likes to say our doctors practice what they teach instead of the old saying, practice what you preach. Can you talk about the qualifications and the quality of the medical faculty along those lines?
Well, our attending faculty is superb, and I would compare them to any major urban university staff. They're all board certified. They come from major universities where they received their training, and this way, and they instill not only the required education to our students in terms of learning the basics and the principles of medicine, but also the art of medicine, how to deal with patients in a professional manner. So I think it's, and they learn too by teaching. So it's a win-win for both our students as well as our staff.
Natalia, you've taken the opportunity to volunteer at the Da Vinci Science Center where we are right now. What are some of the things that have come out of that experience for you?
It was definitely a great experience. Not only did I get to see the exhibit, but I also had an opportunity to interact with some of the people from the community who came in, and they actually asked me questions about some of the specimens that they see here. And it showed to me that I actually remember something from last year. For example, when we learned all of the anatomy in the first block, and I thought I forgot it, but I actually knew a lot. So it's definitely a great feeling.
Perhaps reinforces what you've learned to talk it out rather than just look at it in a textbook. Nicholas, what's impressed you the most about your experience in the St. Luke's program so far?
Yeah, one thing that I think is really great is they're training you to be awesome physicians right from the get-go. Okay, you obviously have to learn all the basics about, you know, what are the dosages of drugs to give and things like that. But even from the very first week of residency, at least as a family medicine resident, they start you off with your own patients that are yours, and it's your responsibility to follow them. You obviously have a lot of people that have your back. If you have questions, if there's things that you don't understand. But I think that's a really neat thing. And as you build relationships with patients as you go along, whether you see them in the hospital, that rapport grows even more. And, you know, eventually we have patients coming up to us saying, "Oh, I remember you were my doctor, you know. Would you mind if I come to the clinic and see you? I have this complaint." So it's really neat that they're fostering that relationship with their patients.
Nicholas, let me ask you to elaborate a little bit more on that, because there's a tendency sometimes to think about a residency of just focusing on inpatients, and yet we understand, of course, in primary care that your major thrust is going to be treating outpatients. So what kind of experience do you have and do you get in actually interacting with patients?
Yeah, it's a great question. You know, I think it's important to make sure you understand inpatient medicine because, you know, you will have patients that are coming from hospitals that are going to hospitals, so it's important to know, you know, when are the times that you need to refer them. But really, the majority of medicine, I would, you know, posit, is actually best managed as an outpatient, where you can really take the time, discuss with patients about their disease, educate them, understand where they're coming from, and really come up with a plan and adjust the plan as you go, because, you know, like most problems, it's not solved in a day. Very few diseases are solved with just one pill. It's a process of learning and improving.
Great. Learning and improving. We'll take another break right now, come back with our guests from St. Luke's. It's all about education tonight. Stay with us. We'll be right back.
Welcome back to our show on medical education. Joel, there's a tendency for many people to feel that doctors are unidimensional. And so can you comment on the importance of work-life balance and what we're doing about it?
Jeff, that is a superb question. As part of the doctoring course, we have discussions on professionalism and well-being, your own well-being as a physician. And today we discussed an article from the New York Times Magazine on life outside of medicine. And we talked about the need to have outside interests so that you can handle your stress that comes from the day-to-day interactions, either in treating patients as a physician or in learning the art and science of medicine.
Natalia, do you have any free time now that you're in medical school?
I thought I wouldn't, but I kind of learned to balance my time so I can still pursue my other interests, especially on the weekends. But when the exam time comes, we all kind of just stay in the library and not do much else besides studying. But it's not that bad, actually.
So there's life outside.
There is life outside, yes.
Nicholas, does it get any better as a resident?
Residency is pretty busy. You know, there's not much that you can avoid in that sense, but I think it's important to know that gone are the days where you have residents that have been up for 48 hours and become zombies. Really, things have changed, and, you know, we want to make sure that everyone's happy and healthy when we're working with patients.
And that they're not overtired when they're making
Exactly.
decisions. Joel, medical education is dynamic, and it's not the same now as it was 100 years ago. What are some of the changes that you can see coming in the future?
Well, it'll definitely be more interactive. We're doing away with lectures. We're putting more things in terms of modules over the internet so students can learn at their own pace at home. And then when they come to class, it's more of a discussion. It's more to clarify points, any questions that they may have. Right now also we use, make it more interactive in that when we discuss things with the class, we'll put up cases and then put some questions afterwards and see if the points are getting across the clicker so they can pick the answer, and then we can know right then and there if they're learning what we want them to learn.
Medical education, it trickles down hopefully to the patients and benefits them as well. That is our show for tonight. Special thanks to the folks at the Da Vinci Science Center here in Allentown for welcoming us, and thanks again to our guests. Be sure to join us next Monday. Thanks for watching. We will see you then.
My St. Luke's is your window for more information about tonight's topic or any other medical issue. For physician information and referrals, or to learn more about St. Luke's healthcare services, call St. Luke's InfoLink toll-free at 1-866-ST. Luke's or visit www.sluhn.org.